Today I'm going to present about the research methods or research approach part 2, which is mostly covering the qualitative research methods, how to report it while you write your proposal. And then briefly, I'm also covering mixed method approaches in this lecture. So to start with qualitative research, it is done to understand, describe, or define an event, and it generally depends mostly on the perspective of people. So we are trying to analyze and understand the perspective of people much deeper than how we would collect information from a quantitative study. In general, qualitative approach can be ethnographic, that is studying human society and culture, immersion in culture and interpret through point of view of an insider, whoever is the part of that culture. It's mostly done by anthropologists. Second approach is the grounded theory approach. The theory emerge from data and compare units of data against one another under the categories properties and hypotheses emerge. It is usually done with a very open mind. The scientists or researchers go to the study participants and then they collect data without much hypotheses. And then the hypothesis emerges out of the data that has been collected. It can also be a case study that describe and interpret one specific case or event in details. Another approach is the phenomenology, which is to see a phenomenon or experience from the perspective of who has experienced it. It can be a narratives research using stories or life narratives, and it can also be interpretive, inductive strategy, that is collecting data from interviews, observations, or document analysis, and then analyze the patterns and identify common theme out of that. In general, qualitative research methods include population. So we would conduct in-depth interviews, key informant interviews, focus group discussions, and observations, which can be participatory or non-participatory. We can also do desk review using online research, like literature reviews and case studies. These are the very commonly used terminologies in qualitative research, deductive and inductive. So if the theory guides the data, it is called deductive. It starts from general to more specific. And if the data guides theory, that means if the theory is extracted out of the data, then it is called inductive. So it starts with more specific and then comes to more general. So I am going to present an example of how we can write a proposal with qualitative research methods. The example is from this study, Facilitators and Barriers to Healthy Eating in a Worksite Cafeteria, a qualitative study from Nepal. And the objective was to explore perceptions about healthy eating, as well as potential facilitators and barriers to healthy eating among employees in a wire manufacturing factory in Nepal. I'm briefly covering these sections that has been that would generally be included in the proposal. Researchers' characteristics and reflexivity, context, sampling, sample size, ethical issues, data collection methods and instruments, unit of study, data processing, and data analysis. So unlike in quantitative study, qualitative study is very much dependent on the skills of the researcher who is collecting the data and who is analyzing and interpreting the data. So it is considered very important in qualitative research to report personal attributes of the researcher, that includes gender and culture, sexual orientation, etc., and qualifications and experience of previous qualitative research of the researchers, relationship with the participants, in what way the researcher is already familiar, or what aspects of the participants does the researcher already know is important. And then also the assumptions with which the researcher is going into the field for data collection. So it is important to specify or report all of these characteristics and reflexivity in the proposal, as well as while you publish the report or manuscript from qualitative research. Second important thing is to report a context, site, and the contextual factors. So for example, in this study, we have said that this study was conducted in a wire manufacturing factory in eastern Nepal, with about 745 employees. One of the investigators, PP, provides health promotion and preventive services in the factory as a physician. So this is providing a context of what is the relationship of one of the researchers with the participants. The study was conducted to collect information to assist in development of healthy eating intervention in the cafeteria of the factory to prevent type 2 diabetes as a part of a larger health promotion program. So we are providing the context specific to our aims or objective of this study. Third is the sampling strategy, how and why research participants' documents or events were selected, and criteria for deciding when no further sampling is necessary. For this study, we randomly selected from a list of employees of the factory and stratified by job type. For example, administrative staff or manual laborer. For the in-depth interview, we purposely selected three cafeteria operators from each of three cafeterias. So when you are doing a purposive sampling, which is very common and very encouraged methodology for qualitative research, it is also important to report who you are selecting and why, because we are selecting to meet a specific purpose. So we also need to specify what purpose is that. So here we are saying that we also selected a company manager who serves as a major decision maker of cafeteria in the factory. The interviews were conducted to understand the individual perceptions among cafeteria operators and managers about the facilitators and barriers to healthy eating. Each cafeteria operator represents a cafeteria. So we are providing a reason here why we selected a cafeteria operators, and then a manager is chosen because this is the person responsible for decision making and changes in the cafeteria. So our study's specific objective was connected with another larger study that aimed to develop an intervention to promote healthy diet in the cafeteria. So it was important for us to get the perceptions of both cafeteria operators and cafeteria managers who would be in future making the decisions about the changes. Fourth is the sample size. How many interviews are enough? In terms of number of interviews, it's and also true for the focus group discussion, we would look for data saturation in a qualitative research. So it is very common to specify that we stopped data collection when we reached our data saturation, but how many to plan in the initial stage is a major question. And this is a study by Dr. Henning that reports what is the optimal number of interviews to reach a data saturation. Here, the black block represents actual interview order in which the interview was happened, and then there is a gray block which represents a random interview order. So after conducting the interview, the analyst selected the interviews in random order and then started coding it. So here is the y-axis is the number of codes. So in the first interview, about 24 codes were generated. In the second interviews, an additional 5, and then third interview came with additional 5, and then fourth, fifth, sixth, and so on. added about 1 to 3 codes. So if we look at this section, up to 6 interviews, about 53% of the codes were identified. At 6 interviews, 84% of the codes, at 1 interview, 53% of the codes were identified. At 6 interviews, 84%. At 9 interviews, 91%. And at 12 interviews, 93%. And we can see that after 20 interviews, like no much codes were generated. Like after 24 interviews, codes were not generated. So data saturation reached at 24. So when we plan our study, we can like plan something in-depth interview, something in between 12 to 24, and then we would mention that we would stop the data collection if we achieve our code saturation. Code saturation is different from meaning saturation, and in the same study, we see that even within a code, we can achieve meaning saturations after about 3 additional interviews. So for example, if feeling well is our code, and then there can be different meaning of feeling well. For example, maybe some participants is explaining about, okay, I feel physically fit, or some participant explaining about like I feel mentally great, or or other participant would think like I have a very balanced lifestyle and feel good. So even within the feel fit, feeling well code, we can have like a different meanings that we are assigning this code for. So to achieve the meaning saturation, maybe we can plan for 3 additional interviews. Similarly, how many FGDs are enough? This is also a study by Dr. Henning. So y-axis is the number of new codes generated, and the x-axis is focus group number. So 1 to 10, number of codes developed, 60. So at the 1 FGD, 60% of the codes were developed. By second FGD, 84%, third FGD at 88%, and 4 FGD, 94%, 5 FGD, 96%. By 6th FGD, 100% of the codes were developed. And it doesn't matter whether you do coding by inductive method or by deductive method. The code saturation has been achieved by the 6th focus group number. And however, if we are planning to do compare between subgroup, and then we are planning to do FGD with different heterogeneous group, then we have to plan for this 6 FGD with each group. And also another thing to note is, even though this study has shown that it takes about 6 FGDs to reach the code saturation, in reality, like it can be less or more. So it would be necessary for you as a researcher to plan accordingly. Another important issue about qualitative research is how many interviews that actually shall we report in the ethical application as well, because we don't know until we have analyzed the data, like whether or not we achieve the code saturation or data saturation. So generally, we would give a range in our application from minimum to maximum based on our expectation, and then you can also refer to these articles to set your expectation, and always mention your upper limit in your application. So in the ethical issue, the research has to be approved by ethical board. You have to receive informed consent, whether in written or verbal. Now, NHR, Nepal Health Research Council, requires to record all of the verbal consents as well, how to mention the confidentiality of the participants, and how to ensure the data security. Sixth point is the data collection methods. In the methods, we can use observation, in-depth interviews, key informant interviews, or focus groups discussion. So we would report all of the data collection procedures, start and stop dates of data collection and analysis, iterative process, which actually means that in qualitative research, we can improve our subsequent interviews or group discussions based on our experience with the previous interview or group discussion. Unlike in quantitative research, where we are not allowed to change our tool at any point in the study, and we need to use a very standard uniform tool to all participants. Qualitative research has a very unique advantage that we could actually improve our tool or modify and adapt as our tool as we go move further with the data collection. Another thing is to think about triangulation of resources or methods. Triangulation generally means verification of your results or your data from different sources or different methods. And then also you have to report any modification of procedures in response to evolving study findings. This is how we reported our interview. So we said that we conducted semi-structured, in-depth interviews with the cafeteria operators and managers using a pre-tested interview guide. The goal of the interviews was to obtain information regarding the facilitators and barriers to healthy eating from the cafeteria operators and managers' perspective. So then we have to report all of these procedures. Each interview began with an introduction, which included a brief explanation of the study and ethical considerations about maintaining confidentiality of the participants. The interviews were conducted in a private room, very important to ensure that confidentiality or privacy was mentioned, in the factory to ensure confidentiality and facilitate honest sharing of opinions. The interviews lasted for 90 minutes and were audio recorded. We used an iterative process for data collection. This is an example of FGD. Participants reported demographic information, age, gender, education, income, lifestyle behaviors, alcohol smoking, and presence of chronic diseases, hypertension, diabetes on a brief questionnaire administered prior to the FGD. The FGDs explored participants' perception of healthy eating and facilitators and barriers to healthy eating at work site. All FGDs were conducted in Nepali by a native Nepali speaker. Each session began with an introduction, which included a brief explanation of the study and ethical considerations about maintaining confidentiality of the participants. The FGDs were conducted in a private room in the factory to ensure confidentiality and facilitate the honest sharing of opinions. The FGDs lasted for 45 minutes to 60 minutes and were audio recorded. We used an iterative process for data collection. After each FGD, the study team debriefed the discussion and identified key themes emerging from the discussion and topics to be explored further, and subsequently revised the guide. Another section would be data collection instruments and technology. So in this section, we would provide descriptions of the instruments, interview guides and questionnaire devices that we used, audio or video, and if and how instruments changed over the course of study. Interview tool, example of reporting an interview tool. The researcher interviewed the participants with open-ended questions regarding their perception on healthy eating. So it is very important to mention that the questions were open-ended. And then in the interview guide or FGD guide, close-ended question or question that whose answer can be given in yes or no, it's better to avoid those kinds of questions. So the researcher interviewed the participants with open-ended questions regarding their perception of healthy eating, facilitators and barriers to healthy eating worksite, operational and managerial aspects of the cafeteria, and facilitators and barriers to making changes that promote eating. So we have also provided some examples of our questions, and it is highly encouraged to do so in your proposal. So we report that we asked questions such as what foods are healthy and unhealthy in your cafeteria, what changes would you want to see in the cafeteria to make it healthier, what factors would facilitate making the healthy changes, and what challenges do you anticipate in order to make healthy change. In each case, the interviewer probed for sufficient descriptive information. So in qualitative research, we go with a very general guideline, and then based on the answers from the participants, the interviewer probes for more detailed information. And this is an example of reporting FGT tool. We used a semi-structured FGT guide in Nepali language. We pilot tested the FGT with 9 participants in the study population. The question in the guide covered 3 main domains: perception of healthy and unhealthy eating, facilitators to healthy eating in worksite, and barriers to healthy eating worksite. And it is highly recommended to use some kind of theory or model or framework to kind of to build your to build your research interview guide or FGT guide. And the moderator asked open-ended questions, very important to ask open-ended questions to the participants about their opinions and probed for in-depth information. The questions included, again, we have given the examples of the question here. This is not the list of all of the questions that were included in the guide, but only some examples. What do you understand by healthy and unhealthy foods? What factors affect your food choice? What can facilitate you to make healthier choice, and what obstruct you from making healthier food choices? All participants were encouraged to share their honest opinion. In the unit of study, we could report the number and relevant characteristics of the participants, documents, or events, and this can also be included in the results section. For the data processing, we would report or write the methods for processing data prior to or during analysis. So how the transcription was done, how was the data entered, if any analysis tool or software were used, how the data was managed, how was data security mentioned, how was data verified, how was it coded, and how anonymization was obtained. This is an example of writing the data processing. Audio recordings from FGD and in-depth interviews were transcribed verbatim in Nepali by 2 trained native speakers. Investigator reviewed the full transcripts and compared them against recordings, which is a very important step to verify your data. We used inductive coding to allow findings to emerge from frequent, dominant, or significant themes inherent in the raw data. You could use inductive or deductive coding method based on your research objective. For the data analysis, we would report the process by which the inferences themes were identified. In this study, we used thematic analysis. So we have said that data was analyzed using thematic framework method to identify the themes related to healthy eating as well as facilitators and barriers to healthy eating in the cafeteria. The investigators, PPAS. So it is also important to report like who would be doing the data analysis. So here 2 investigators, PP and AS, read through the transcript several times to familiarize themselves with the data. So we are also giving some details about what we exactly did in our thematic framework method. The text was then divided into meaningful units, such as phrases and quotes, and the meaningful units were then condensed. The condensed meaningful units were then abstracted and labeled with codes independently by 2 investigators. And here also in qualitative research, it is recommended that the transcripts are coded by 2 independent investigators and their agreement should be at least 80%. And we used RQDA software, which is available free. The various codes were compared on basis of differences and similarities and sorted into categories. The categories were further discussed by the investigators for identifications and formulations of themes and subthemes. So a few things are important here. First, specify what analysis method you are using, and then specify who is doing the coding. And then also it would be important to report how the consistency in the coding is maintained. So here what we did was all of the transcripts were independently coded by the two investigators, and sometimes which is very acceptable is that two investigators code few of the transcripts separately and then they discuss, and until they get to an agreement of 80%, and after that point they independently code separate transcripts, and then all of the transcripts are then analyzed together. So there are a few techniques to enhance credibility of data analysis. So one of the biggest criticism that qualitative research and qualitative researchers get is its subjectivity. So we want to minimize that as much as possible. So to enhance the credibility, we can do member checking. That means data and results are returned to the participants to check for accuracy and resonance with their experiences. We can do audit trial, which is highly recommended. Is describing the process in a very transparent way. And then we could also do triangulation using multiple sources or methods to study one phenomenon. So this is an example of the audit trial that we did in our study. So we presented an example of how we defined our codes and then how they were categorized into subcategory and then category, and then theme was identified out of this. So in this example, let's say we developed the codes, we use inductive coding. So we developed the codes such as mixed food, vegetarian, plus non-vegetarian food, nutrients, fruits, greens, vegetables, salad, wheat, legumes, milk, yogurt, and fish. And all of these codes had a specific definition of the codes, and then the document that contains these codes and the definition is also called code book. So initially we would want to define a very clear code book. And then we categorized all of these codes into subcategories. So for examples, greens, vegetables, and salad went into a category of vegetables. Wheat and legumes went into a category of grains and legumes. And then finally, these categories were also divided into a larger category. So we had only two categories left. So balanced diet and healthy foods. And then the theme was named as description of healthy eating. So how the participants described healthy eating. They described the healthy eating as balanced diet or healthy food, and balanced diet consisted of combination food or combination of nutrients that is further linked with these codes: mixed foods, vegetarian and plus non-vegetarian, and nutrients. And then healthy food consisted of fruits, vegetables, grains and legumes, and meat and milk products that could be further divided into these coding. So now I am jumping into just the introduction of mixed methods. Mixed methods is very commonly used nowadays in public health research. So it mixes qualitative and quantitative studies. It mixes at the same time, which can be done concurrently, or one after another, which can be done sequentially. And then we can choose the emphasis, whether we are emphasizing on our quantitative approach, where we are emphasizing on our qualitative approach, or both approaches. So basic mixed methods designs can be grouped into convergent parallel, explanatory sequential, exploratory sequential, and embedded sequential. So convergent parallel design, we collect quantitative data and qualitative data together parallelly, And then we compare and relate the results and interpret the data. So for example, in one of our studies where we evaluated the package of essential non-communicable diseases in Nepal, we went ahead and did a health facility surveys and collected information about different human resources or medical equipments or like health financing that was available in the health facility. We did an observation with using a checklist. And then at the same time, we also conducted key informant interviews with the healthcare providers there and explored what were the challenges in each of these headings, like human resources or medical equipments or health financing to deliver the PEN package. And then we compare and related both quantitative and qualitative information together and interpreted them together. So this was a convergent parallel design. Explanatory sequential design starts with the quantitative data collection and analysis and follow up with the qualitative data collection and analysis, and then we interpreted them together. So for example, in one of our studies, we were interested to identify the reasons for high performance or low performance of an outreach clinic to provide eye care services. So first we collected data from 30 primary eye care centers, and then we analyzed the data from each center and ranked them as highest performing centers and lowest performing center. And then we purposely selected few of the highest performing centers and few of the lowest performing centers and conducted qualitative study with those centers to identify the facilitators and barriers to using the primary eye care centers in that area. And then we interpreted the results together and then came up with a list of reasons for which list of reasons for providing like high volume services or low volume services from that specific area. In the exploratory sequential design, we start with the qualitative data collection, and it builds to quantitative data collection and analysis, and then we do the interpretation. So, for example, in one of our studies, we were interested to identify the diet patterns in the population in Dhulikhel municipality, but we did not know at that time like what people were eating in that municipality. So we started with the qualitative data collection. We started interviewing people about their dietary habits, what time they were eating, how frequently they were eating, what were their major foods, and what were the major sources of food. So we collected the information from about 16 people, and based on that, we developed a structured questionnaire. So that included all of these, like a very structured questionnaire that included list of the food items that we had identified from our qualitative research, like time of the day, also like information about supplements and other dietary behavior. So then we administered that questionnaire to about 1,000 participants, and then we interpreted the dietary habits and dietary patterns of that population. Embedded design can have either qualitative or quantitative design. And then within that, another design is embedded. It is either before, during, or after that study. And then we interpret our results together. So for example, if we, in one of our studies, we were doing a cluster randomized control trial to look at the effect of a behavior intervention on postpartum weight loss. So we were conducting this big quantitative study with the cluster randomized trial, and then we did a small qualitative study among those who were not able to lose the weight to explore the further barriers or challenges in that participant that prohibited from them to lose weight. And then we interpreted the result together. So about the mixed method, one last point that I want to emphasize is the mixing should happen at the data analysis phase. So if you are doing a quantitative research and qualitative research separately and reporting those information independent of each other, then we would not consider that as a mixed method. So in order to do a mixed study, we have to kind of mix the data or interpret the data together at one point. So thank you. And then we will talk about sampling and sample size in quantitative study in our next lecture.